Well, we do provide care for people who don't have insurance. People, if someone has a heart attack, they don't sit in their apartment and die. We pick them up in an ambulance and take them to the hospital and give them care. And different states have different ways of providing for that care.
That's the most expensive way to do it.
Well,
in the emergency room.
Different states have different ways of doing that. Some provide that care through clinics. Some provide the care through emergency rooms. In my state, we found a solution that worked for my state. But I wouldn't take what we did in Massachusetts and say to Texas, you've got to take the Massachusetts model.
Do you believe in universal coverage?
Oh, sure. Look, it doesn't make a lot of sense for us to have millions and millions of people who have no health insurance and yet who can go to the emergency room and get entirely free care for which they have no responsibility, particularly if they're people who have sufficient means to pay their own way. And so we said, look, we got an idea. Let's take all the money we've been spending to give out free care, paying hospitals that give out free care, and let's use those same dollars to help people who can't afford it buy insurance, some portion of their insurance premium. When they show up at the hospital, they get care. They get free care paid for by you and me.
Right.
If that's not a form of socialism, I don't know what is. If people can afford to buy insurance, if they can afford to buy insurance, or if they can pay their own way, then they either buy that insurance or pay their own way, but they no longer look to government to hand out free care. And that, in my opinion, is ultimate conservatism. That's why the Heritage Foundation worked with us and was at the celebration of the signing